a brief presentation, and then we have 5 speakers for today's session, and I'll be actually introducing the speakers one by one. So I'll be sharing my screen. Well, let me start by saying uh, that the theme which has been chosen for this year's conference is the most apt one. So when we say lowering the burden of chronic diseases through integrative thinking, and of course, integrative thinking leads to the implementation and application of integrative medicine. And when we talk about it, I have chosen my whole experience of working with yoga as the foundation for actually bringing and implementing integrative medicine. When we look at integrative medicine per se, uh, and if you ask this basic question, is there a need for integration? Certainly, yes, because we know that the burden due to non-communicable diseases is certainly increasing. And also, apart from these non-communicable diseases, the burden of chronic diseases are also adding to this. And there is a need to minimize this burden. Attempts are being made. Attempts are being made from several fronts, and multiple medical systems are working on this, but unfortunately, we haven't found a solution so far. Also, it is better to produce good clinical outcomes with least side effects when patients approach us. Presently, what is happening is like whenever somebody comes, we are doing our best. Every system, be it conventional medical system, be it various other complementary medical systems, they are doing in silos. They are actually trying to do their best. But when you look at the clinical outcome, we are not delivering the best to a patient who is coming to us. So there is a need to do that, and integration is one methodology by means of which we can actually do this clinical outcomes improve. We also need to provide a cost-effective and long-lasting solutions to patients when they come with non-communicable diseases. Non-communicable diseases actually are looking like a tip of an iceberg. So we don't know its depth to what level it can lead an individual to face futuristic issues and problems and the complications associated with them. Hence, we need a long lasting solution. And also, several times, the healthcare delivery system gets a hit when the costs involved with providing healthcare facility to these individuals really becomes much bigger than expected. Hence, we need a cost effective system. And when we complement conventional medicine with multiple other complementary therapies, I'm sure we can achieve it. Last but not the least is create a healthy society. And it is very much possible when we bring in this integration. Why do we think that yoga can be used as the base for integration? So, because it is time tested and evidence based, we very easily say that yoga is 5,000 plus year old tradition as well as science, because whatever the practices which have been given, and these have been scientifically validated and tested, and clinical protocols have been developed, and even those protocols have been tested, and we have enough evidence to make a beginning in bringing yoga as the base for integrative medicine. Yoga also brings in holistic approach to health and disease. As you can see here, yoga believes in understanding a human being not just at the physical level, but also as a overall, over encompassing personality. So we say that apart from this physical body, we do possess an energy body. We have a sheath of mental being, a sheath of intellect, and a sheath of bliss. So what we need to do is consider each one of them when we treat a disease. It's not just treating the physical body or a disease per se, but also it's yoga provides an excellent uh, methodology as a preventive healthcare strategy, and it's also most acceptable as an adjuvant therapy. When you use yoga therapy along with either conventional medicine or any other complementary therapies, uh, yoga is something which gels, which goes very well, and there are no much issues in bringing yoga as an adjuvant therapy. And it can also influence the most subtlest in the human body, which is all the cellular mechanisms, and it can also influence the most subtlest outside, which means the mind body soul connections. We have lots of evidence talking about both these, and hence yoga has lots to offer when you talk of integration. If you look at the evidence, certainly we have little more than 8,000 publications in peer-reviewed journals as on today, and out of which 25% of publications come from basic research. So that talks the volume of understanding the underlying mechanisms when we use yoga in healthy individuals as well as in diseased conditions. Out of this, subsequently, we have a little more than 65% of publications coming from clinical research, while 10% coming as review articles. This is very interesting because when you look at 8,000 publications, out of which 10% means 800, little more than 800 are review articles. So that shows an interest in people looking in compiling the literature on yoga and presenting it the way it is needed. Also, when you look at how is yoga and yoga therapy being used in clinical management, so as an adjuvant therapy, we have little more than 75% of the publications in which yoga has been used as an adjuvant therapy, along with either conventional medicine or any other method of modality of treatment. 22% is in coming as an independent therapy, while 3% of data or publications talk about standardizing these clinical protocols. So we have actually moved a lot in understanding yoga therapy and yoga. So we have moved from open label clinical trials, which included simple single arm trials, to massed control trials, to uh, um, multiple other control trials. From there to a randomized control trial. And presently, there is a new development of you understanding yoga in a better way using single case experimental designs. So that way, yoga research has been looked upon as something which is very promising and which can probably give us wonderful direction. Finally, I want to end by saying that this is the time for bringing a paradigm shift. So, what we are trying to look at is bring yoga, bring multiple other complementary therapies, and combine it with conventional medicine to give that clinical outcome what a patient is expecting. That doesn't mean that for every condition we need to integrate hundreds of therapies. No, what we need is identify those therapies, look at their clinical evidence, and then use only those which are most efficacious, and those which can produce, which can augment the effect of other therapies. So we are moving from a disease centric approach to a personalized medicine approach. So that's what yoga talks about, looks at each individual as a different individual. And also, depending on medications, we have made all individuals who come to us being dependent on medications. So probably through yoga, we can empower them, and we can take them to a different level of managing themselves and also reducing the load of medications. We also need to move from a physician centric approach, that is, considering physician as a healer, to empowering a body, or considering nature as a healer. And finally, the whole world is moving towards artificial intelligence. Probably I would say use this opportunity, at least let us bring in the conscious intelligence of an individual to empower the body within to heal, or to reverse any given condition to move forward. So thank you very much. And some of these thoughts probably will reflect subsequently in other presentations, what we are going to look at. Thank you very much.
Thank you, Dr. Manjunath. And as you're speaking of the evidence that supports yoga, I just want to highlight that that Dr. Manjunath has actually published more than 100 articles already, and he is also the editor of the International Journal of Yoga. So he's speaking from definitely from a depth of experience and his own research as well. Got a couple of questions for you, Dr. Manjunath. One is coming from Vita. I'm sure I'm probably pronouncing your name wrong. Why don't you just come off of mute and ask your own question?
Sure. Thanks, Minnie. It's Vidhi Takar, and thank you so much, Dr. Manjunath, for an excellent presentation. I really appreciate it. I'm curious to know about your thoughts on the evidence for applying yoga as an adjuvant therapy for people who either have COVID-19 or who have recovered from COVID-19 post-pandemic, and also creating a personalized integrative medicine approach.
Yes, certainly. Of course, during this COVID pandemic, we have learned lots of lessons. So in the beginning, we were not knowing whether yoga will have a role to play or not. So we were thinking it's all to do with the medication or to do with the modern medicine, because it's all to do with an infection. So as the pandemic started mounting up, then we slowly started realizing that the mental component is also equally important along with what an infection, what you are trying to manage. So that's when we started bringing various components of yoga, and we tried a couple of studies during this time. We have used yoga for people who are healthy, but those who are under lockdown. We have used yoga for people who are under quarantine, those who are positive but with no symptoms. We have also given yoga for people who are symptomatic, mild to moderate, and also later, now we are trying a couple of things, giving some simplest practices even in severe conditions. So the results are very encouraging. We have also done a couple of surveys to understand, apart from this, how do you bring in coping abilities and coping strategies during this time? Can yoga provide that ability for you to cope? Second wave in India, at least I know very well that it has affected each and every family. And the psychological well-being of individuals were really tested during this period. And yoga has certainly helped many of these individuals. So it can be simplest form of breathing. It can be some physical activity, not doing extensive asanas, but also doing some part of meditation and relaxation. These things have been shown very efficacious during this pandemic.
Thank you for that. And another question is, like doing the research on yoga being part of integrative medicine, how is it being, I guess, knowledge translation and put into a wide practice in India, as well as what are some of your thoughts around overcoming the traditional way of medicine? Like, so some strategies or thoughts on how do we start to shift people's thinking from what we're going to say Western medicine into more of an integrated thinking, because patients they want a quick response. They want to go get a pill, and they don't necessarily want to take that longer approach. So any thoughts on what has worked in India, or how we may be able to apply this in Canada?
Yeah, very true. I mean, this mindset is definitely there in India too. Everybody wants a quick fix, and everybody wants an immediate relief. And particularly, this thought has gone very deep into our rural population. So at least urbanization has its own side effects, but at the same time, people also pick the developments, whatever is happening across the world, and they have picked yoga as a wonderful tool, either to prevent or manage diseases. But to percolate this thought into our rural population has been a challenge. And we have done a couple of nationwide programs, particularly in diabetes, where we have reached around 2 crore people. Okay, where we wanted to actually see, is it really possible to uh, impress upon our rural population to use yoga along with whatever they are doing for disease management, particularly in diabetes management. It was a challenge in the beginning, and people certainly feel that when I can take a pill and do all other activities, why do I need to spend at least 30 minutes or 1 hour of doing yoga every day? So these questions are asked. But we have this kind of a confidence and success by doing this kind of a project to ensure that, yes, initially we need some additional effort to make people understand, but once they get a hang of it, even if you ask, they don't leave it. So that's the beauty of yoga.
Yeah, and so true, right? Is that once people start to feel better, then that speaks for itself. We'll have one more question. Kathleen Ross has a question. So Kathleen, if you want to come off mute and just ask your question.
Certainly, and I apologize for the quality of my my connection today. We're doing some work on the internet at my house. We have actually started a program inside British Columbia called Parks Prescription, which allows clinicians to actually prescribe connecting to nature to their patients where that's most appropriate. I really appreciated your input here. And I guess I would look for your insights and knowledge as to how we would be able to promote that amongst our physician colleagues.
Yeah, I mean, what happens is certainly we need to, probably the best answer to it is uh, initiate integrative thinking. Okay, because that's where we actually introduce these concepts to our physician friends. Uh, when we need to bring it to a prescription, when we need to make people, along with whatever they are doing, if they need to recommend uh, a very well defined evidence based yoga protocol, we certainly need to do a little more than what we have done so far. Because there are a good number of physicians who have already been looped into this thinking, but the it's very large scale. So this requires a huge amount of effort. But this is changing a lot. Okay, so I would say I have seen it in India. I have seen it in a couple of hospitals in US, and lots of physicians across US, and many other countries outside India. For this, what helps us is bringing evidence. So in India, I would like to just quote this one example of changing this scenario and bringing it to a prescription by All India Institute of Medical Sciences doctors. So what happened was we established a Center for Integrative Medicine at All India Institute of Medical Sciences. And subsequently, within around 2 to 3 years, we have little more than 23, 24 departments of All India Institute of Medical Sciences adopting yoga-based research first, and then using the beneficial effects of yoga and actually adding it to their prescription. So I think this change is very much feasible, and it might take a little more time than expected, but I think we are on right path and it's going to happen.
Thank you very much. And I think that this conference, when we were planning for it and I started to dig a little bit deeper and learn a little bit more about it, I totally agree that I think that the time is right, and maybe even COVID has helped to push this agenda